welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos, and if you're new to us, we're super pumped to have you here. We also happen to be very passionate about healthcare innovation and adoption. And if this is your first time tuning in, let me just kind of tell you a little bit about what we do here. So we're a healthcare innovation company. We're focused on bringing stories of innovation within healthcare to life. And our aim is highlighting real people that are truly innovating within our space and give them a platform to share their stories with the world. And we've got an incredibly action-packed planned year with some amazing new content, incredible interviews that are planned, and can't wait for you to hear about them. And if you haven't checked out any of the historical interviews, make sure you hit the subscribe button now, go back to the library, and just binge watch some of them on our YouTube channel. And I'm super excited about our guest today. In today's episode, we're excited to introduce our guest, Eric Alvarez, the founder and CEO of Grapefruit Health. Eric's got a wide range of experience in the industry, and he's really passionate about improving healthcare delivery and patient outcomes. And prior to founding Grapefruit Health, he held a wide range of leadership roles at some renowned healthcare organizations. And I'm looking forward to kind of just diving into this conversation with Eric to kind of learn about his journey within healthcare, the vision behind Grapefruit Health, and the future of healthcare innovation. So, Eric, welcome to the show.
Thanks a ton, Michael. I appreciate it. Happy to be here.
Yeah. So let's maybe let's fill in some color. I think your background's pretty interesting in terms of going from healthcare administrator to then kind of moving into sort of the innovation transformation space. Can you maybe share with a little bit of the audience, a little bit of your story, and then we can kind of dig in from there.
Yeah, absolutely. So, grew up in the Chicagoland area, was kind of always a lifetime entrepreneur, always had ideas. I started my first startup, if you will, as a 13 years old, doing oil changes at people's houses. Like my dad, we were a very blue collar family, taught me how to fix and work on cars my whole life type thing. And so, had a couple local clients, customers, including my parents, to do that. So that was interesting. Eventually, was never going to really go to college. Joined the military when I was 18, the Air Force, fixing jets. I thought I would take my mechanical kind of interest and work on jets. But after being in the military, kind of grew up. I needed that kind of kick in the butt, and wound up getting a bunch of education. So I went to Southern Illinois, Carbondale, to study aviation management with a minor in speech. Played rugby there. I actually sit now on their board for their colleges of healthcare and human sciences. And then I went to Rush, which is a kind of a funny thing I'll tell you about here. But went to Rush University to study hospital administration. It's a top 3 program in the country. And now I also sit on faculty there, and I've sat on some boards for them. But it was really between undergrad and grad school, I was doing this bicycle trip. I rode my bicycle across the country for charity. And it was this really cool feeling of feeling like you're helping people. And I was thinking about leadership in aviation. It was 2008, so there was no jobs. A lot of people were going to law school, and I didn't know what I wanted to do, and heard about this awesome program at Rush, and it was really my only program I applied to. And I think I got in because of my veteran status. I don't know. But got in, and sort of, the rest is history.
Pretty amazing. Thank you for your service. It's good because it sounds like there's a common thread between everything that you're doing is you're a builder. You create things.
Yeah.
So let's talk about how Grapefruit Health, the concept of Grapefruit Health, came to life.
Yeah, and you're right. I've always been happy I do a lot of career mentoring now too. But like for me, there's like usually builders and like maintainers. I'm happiest when I'm building, and I don't mind doing some maintenance work, but I don't want to run an established department of surgery or something of that nature. Like it'd be exciting to build that, and then sort of move on or move up on there. But after graduate school, got a job at University of Chicago Medicine and then Northwestern Medicine, leading teams of over 100 FTEs, everything from at the service line level, so revenue cycle and patient sat and staff management, fill in the blank. And that was great. And it taught me a lot about hospital administration. I was also part of 2 Epic go lives, and I didn't realize it at the time, but became Epic was really expanding at that point. It became required by the government to install EMRs in all health systems for maximum Medicare reimbursement. And so got to be part of those. I got to speak at the Epic conference in Verona a few times on some of that work. From then, I also recently had joined the faculty at Rush as adjunct faculty. So then I got a lot of exposure to students, both clinical students and non-clinical students, hearing what they needed, what they were looking for,
Right.
to the point where they recently named me Alumni of the Year because of that work. And then in 2015, I joined a startup as the first employee and chief operating officer. We grew that for 5 years and eventually were acquired by Cerner. And so really at the intersection of healthcare administration, healthcare education, and then healthcare entrepreneurship is how I was able to come up with the idea of Grapefruit Health. And I can tell you more about it, but
Yeah.
really you kind of had to have those experiences to come up with this idea. And so I'm happy to go into that now.
Yeah. I was going to say, it sounds like what being in the military, you've got your tours of duty, and each tour you learn something, and you take it in sort of the next tour, and as you kind of combine all those things, yes, Springleaf into grapefruit for sure.
Yeah, absolutely. Life is about progress and not perfection, right? And so all of these journeys start to get compounded, and you're starting to see just like compound interest, you're starting to see the results, and you can do more as you've developed more diverse experiences, in my opinion. But at Grapefruit Health, what we're doing is we're addressing this massive staffing issue in healthcare. Everyone's acutely aware of this, but if you're not, we're short by 3.2 million healthcare workers across the country. That's the population of Los Angeles. And you see solutions out there that are leveraging the current workforce, right? Which is what we're short of. Things like recruiters and travel clinicians, staffing and gig platforms. What they're doing is moving the pieces around, right? The people that are out there in the workforce today, they're moving those pieces around, and those that can afford those resources can pay a premium and take them from other locations and solve their immediate problems. The problem is it's become pretty predatory to the point where the government now is actually stepping in and looking to cap what travel clinician organizations and some of these other groups are actually even able to charge, because it's become unsustainable for a lot of healthcare organizations. So how did we become innovative? How do we think about Grapefruit Health? Well, with all this working with all these clinical students and these other students, they were desperate for work. Healthcare systems were desperate for workers. So we said, hang on a second, let's create a national workforce, the first one ever, that's exclusively composed of clinical students. We now recruit, train, and manage these students onto our technology platform called The Grove, which is a cute name. That's where grapefruits grow, onto the platform. And then they perform work for healthcare organizations remotely. And what's exciting is at any given point in the United States, there are 1 million students pursuing clinical education. So it's the opportunity for 1 billion new patient touch points per year, saving the US healthcare ecosystem 35 million hours. So what's really unique and novel and innovative here isn't the work. The work is mostly, we can go into this deeper, it's mostly telephonic outreach and tasks that we're doing remotely. What is innovative is the workforce. We've identified a resource that no one has tried to operationalize nationally before, and that's what we are doing today.
How come you think that? How come no one has tapped into this resource before? I mean, they knew about it.
Yeah.
What held them back? What are some of the constraints?
It's a great question. I get that asked a lot, especially by investors. Here's why I think it is, after all the meetings I've had and a million informational interviews, et cetera, is that it is being done, but in microchasms, right? So there's not a single health system across the country that doesn't have a student employed or on a floor or learning or engaged in the process in some way, shape, or form. And so I think a lot of organizations individually are saying, let's use students to potentially solve this kind of problem. And then their HR teams are bogged down. They'll bring in 2 or 3 students and, they'll candy stripe, right? Or they'll help do COVID injections or something just very, very, microchasmed in a very, very unique use case. At Grapefruit Health, I think the reason why no one ever thought about, let's just build a national workforce of clinical students before is, one, it's really freaking hard. There's a lot of labor law here, how we comp and how we're able to utilize a student and what's legal and what's not legal, and state lines. There's a lot of consideration to what you're doing. You have to be very familiar. And fortunately for us, our team is made up of clinical educators, hospital administrators, and clinicians and technologists. So we have that experience and we have a great head start. So I think the reason why they're like, well, we were already doing this. That's why we're not doing it on there. And I think it takes a unique perspective to have thought, hang on, what if we do this not just in a single health system, but we do this across the entire country?
Yeah,
To,
scale. Are there certain when you started, are there certain areas that you felt like this needed to be prioritized? Are there certain cities, certain states where the need was much greater than other states? And how did you kind of think through that?
it's a good question. I think as a startup, we oftentimes, especially we're 1 year and a quarter in to our journey here. And so we'll take what we can get type thing, right? So it's wherever the interest is, we're going to say yes, or we have said yes. So we didn't really have a chance to be like super strategic. We kind of, the spray and pray or whatever the, analogy is there. And so whatever we kind of hit is what we've kind of taken on. And we've been very fortunate. Some of these contracts, we can get into it, are extremely exciting for growth. I do think, though, I used to think that we were very much a rural play, like that the rural systems and clinics were going to utilize us more because they're the ones who have been hit a lot by this travel clinician problem. So
Yeah.
a lot of their clinicians are the ones that are getting recruited to these urban areas, more affluent health systems with bigger budgets, who can afford to pay 3, 4, 5x a W-2 clinician's wages. But what I'm seeing now is that's actually not necessarily the case. We're seeing a lot of safety net, very urban, massive patient population, but more safety net or like second, third tier health systems who are having the recruitment problems, but their volumes are still they're not rural volumes, they're urban volumes. Like you're talking huge, and they're missing all of their tons of gaps in care. So things like post-discharge follow-up calls. Nurses don't have time for that anymore, right? And whether you're the most affluent tier 1 health system or you're tier 3, doesn't matter. When you discharge a patient, best practice is to follow up with them. Are your wounds healing? Do you have your primary care visit, right? And the more underserved the patient is, typically the more complex that follow-up is. We can do that for our clients now at a high volume there too. So to answer your question, I think it's the more urban tier 2, 3 safety net health systems is the target on the provider side, at least. We're also working with MSOs, MCOs, so management service organizations, managed contracting organizations, or managed care organizations, as well as payers, both traditional Medicaid, ACO, MA targets.
So let's talk about the training of the, I'll call it the supply, the talent that you're
Sure.
matching to where the need is. Talk a little bit about that and what type of training do they go through and what kind of, I mean, you mentioned a little bit about some of the functions that they can do, but how, I guess, how deep can they go?
Yeah, great question. So starting at the end there, we really think about Grapefruit Health. The work we can do is any high volume, low acuity work that doesn't require clinical licensure. And if you're in healthcare, you would know the answer to that. But if you're not, like, live, breathe, eat it, if you've never been on the provider side, there's a lot of work it's being done by licensed clinicians that doesn't require clinical licensure on there. But on the training side, we have a very robust onboarding. So it's this background check portion. They have to do a lot of we do reference checks. We're the turnkey HR. So we don't ask HR of the client to do anything. And then they go through a lot of their own self-guided training. So they have over 20 different modalities of training they need to go through. Sexual harassment training, how to process and deal with suicidal ideation, therapeutic communication, motivational interviewing. So it's hours and hours of this kind of self-guided work, which is critical for a startup that needs to scale. Like some of that has to be automated. We're about 60% automated in that. And then we have our specific task-based training that is live. We do that remotely. We do a bunch of one-off and breakout room sessions where, for example, we're going live with a client in Eastern Tennessee in 5 days, next Tuesday. And we're going to be doing all their medication adherence for them with third-year pharmacy students. So those pharmacy students know what medication adherence is. They know a lot about drugs at this point, and they might have had some internships or clinical experience. They haven't done their big rotation yet, which is their 4th year. So what we do with them is we do, sort of a retreat, and we do hours of this kind of back and forth training and what it looks like. Medication adherence does not require clinical licensure to do. MedRec does, like if you're going to modify a medication or something. Right. When those come up in those conversations, we teach them how to do warm transfers. So the 5-10% of the patients we talk to that actually need a licensed pharmacist or pharm tech, we just do a warm transfer. So we're like a force multiplier in that regard. So that's sort of the training. And then we have this entire quality assurance process. So we use actually another innovative thing we do, which I'm probably oversharing. We use retired nurses. So retired nurses are doing some of the Q&A for us, and they're comped on a kind of a per call. They listen in on the call and coach our students.
It's really nice because then it kind of closes the feedback loop and it gives them that real time feedback in a sense on how they can improve. What about, let's just say some of these students perform extraordinarily well and that health system wants to bring them on full time. What happens then?
That is a massive part of our value proposition. About a third of our prospects come to us for talent pipeline building, which I never imagined as a founder. That was one of those, aha, like there's something massive here. And the idea is that, like literally just the other day, I was talking to the largest Medicaid insurer provider out on the East Coast, and they're looking specifically for that. They're getting crushed on hiring. They can't hire. And so they're looking for really novel, unique approaches. What's more novel than Grapefruit Health being your infrastructure, bringing 200, 300 students into your organization? Your HR team, though, and trainers, et cetera, do not get bogged down. We're doing all of it, but you get their eyes and ears. The students learn your patient population. They learn your brand. They learn your business. They learn how, in this example, Medicaid is provided or serviced, I should say. And then it's like a natural progression. And if you know clinicians in a positive way, they're sort of a kind of a creature of the known, right? And so for them, it's, I know this health system. I'm brand new. This is scary enough to go from student to licensed clinician.
Yeah.
I'm going to do it with an organization I feel comfortable with. So it's a natural progression for them to then get employed and to come into the organization. We do not charge for that today. That's just an additional value proposition of what we do.
It's kind of like you're building the farm system. You're helping them build a farm system to kind of produce the talent, place it.
Right.
Sounds amazing. I have one thing that you don't have control over, which is the culture of some of those organizations. How do you influence the culture of an organization? So you're bringing in this unique talent, they're fresh, they're excited. Talk about how those two worlds kind of mesh and how do you kind of take a temperature check of the culture of an organization that you're going to be, exposing some of that talent to those organizations? What are some of the measures that you guys look at to make sure that these are cultures that are healthy enough so that the fit is really sort of seamless?
Yeah, it's a great question. I think on the provider side, there's not too many known provider organizations that are like bad actors. If that makes sense. Yeah. There are certainly plenty on the for-profit side of the world in general, vendors and insurers that may or may not be considered bad actors by the larger healthcare ecosystem, right? And those are groups that we just wouldn't engage with. Like we're willing to just not work with those groups. But on the provider side in general, how we match cultures on there too. So even though Grapefruit Health's culture is going to have a major portion of this because the students do work for Grapefruit Health as 1099 contractors, we do work very closely with the client. So we match all of our branding with them. So for example, our training decks are co-branded. The scripting we use with our students when they're actually calling the patients, that's all co-branded. Our text messaging systems and all that automated outbound stuff is all approved and co-branded with the client. And the clients have any option. They can say, we're calling on behalf of the client. You could say we're Grapefruit Health calling on behalf of the client. You could totally white label. They really have a lot of control. And we need to follow their best practices, to be honest. We don't want the patients to feel like this is a total third party and we're, messing with the care continuum in any way, shape, or form. We want it to be as aligned as possible. But yeah, around culture, it's really that. And it's highlighting the organization or the client's culture within those onboarding sessions, those orientation sessions. We even do a deep dive on who the organization is and why this work's important. Like how often do we hear that when we go to job interviews, right? Or job orientations. We talk about like medication is important because, and it's especially important in this population because, and so they get to kind of hear that and learn that.
Yeah, I think, it's positioning, and where people fit into the equation. And that matters from a leadership perspective. It makes all the difference in the world.
Yes.
Is, the reason why you're doing something.
Yeah.
I sat through a lecture of a gentleman that had started the Ritz-Carlton group, and he
Oh,
was
wow.
talking about some of the things they were doing when they were onboarding. And he would always greet new employees in this way. The guy's name was Horst Schulze, was a German guy. And he would say, I'm Horst Schulze. I'm the CEO, and I'm very, very important. And then he would pause and say, and so are you.
Oh, that's awesome.
He would kind of put it back on them. So that just, your story that you just mentioned there just kind of brought that into the top of mind.
And
Um,
just to kind of add to that a little bit too, for the client side, what's pretty cool is that because they're going to get exposure to these students and they're going to see the results of the students' work, they get to kind of learn about the student before they would want them to come work for their organization. So on the question you asked me, culture going out, it's also making sure that you're hiring for culture going in. So the organization is going to sneak peek into these applicants, right? As a very deep sneak peek, actually.
so are they given scorecards on their performance, kind of like a
Yeah.
report card in a sense?
Yes, they are, and they trend up or down, and that's what we have to need to do to maintain quality. One thing we're really lucky about is we have an overwhelming amount of student interest. I mean, we're emailed actually internationally now multiple times a day because of some of the press we've gotten on there. So we can be very, very picky with our students for now.
That's pretty awesome. Has there been anything in this journey so far in terms of what you've done, how you've deployed at particular client sites that's just really surprised you and taken you by surprise, good or bad?
I would say the demand on both sides, how like, I don't want to use the word desperate, but just how like interested the student is in working in this way. They are like they come in very strong. Like they want it so bad. And then the other side is when you go into a client organization and you start to discover some of these things, there's a lot. And again, it's no fault to their own. I really don't think there is. I mean, maybe it's the fault of the larger healthcare ecosystem and how we've set up the
Yeah.
system and how sick our patients are and the population is, et cetera. But beyond that, the individual organization, it's to no fault of their own. There's a lot of things that aren't getting done, like a lot of work that we can really easily, and we are taking off folks' plates to let them operate at the top of their license. I think those are two things. The other thing too is from a company, we started off, by the way, is only nursing students and only seniors living in isolation and loneliness. That was our very first pilot. We were going to be like this, if you're familiar with Papa Health, like a
Yeah.
low cost, much better and higher utilization remote Papa to work on that. And then when we started having all these discussions with investors and clients, they're like, why only nursing students? And I'm like, well, that's a good question, because social work's, pharmacy, pre-med, physical therapy, fill in the blank.
Yeah, yeah.
And so I was like, oh yeah, they can all add value. And then they're like, why only seniors in isolation? Why not post-discharge, medication adherence, getting patients in for their annual wellness visits, diagnostics, delivering negative test results. Like for I can't say their name, but they're a large government-run provider. We're going to be training them on how to use their health portal before their appointments. I never thought we would do that. So nursing students are going to be training these patients on how to use their health portal, how to get a medication refill, how to request an appointment, how to do an e-screening. So we're going to do tech training, which scales really well for us. We don't need integrations with EMRs or anything of that nature. So I'm shocked.
When it's not shocking to me, because when you think about the audiences that you're dealing with, right? Sometimes people feel like straight tech is the answer. But when you think about innovation, at least the way that it's defined for me is being able to add value to many. And you're meeting people where they're at on their journey. And some of these patients that you're reaching out to, perhaps they still want the human touch. I mean, healthcare is a person-to-person team sport. Elements of it can be done digitally, which it sounds like you're augmenting and you're doing, which is fantastic. And
Yeah.
there's still that person-to-person interpersonal relationship that matters. Do you find that now being more important with the chat GPTs of the world taking the world by storm?
Yeah. What I love this, by the way. This is like an amazing dialogue because I feel very strongly about this. First of all, we need technology we're going to need to solve this massive gap in healthcare. And by the way, that 3.2 million gap is like just to get us to baseline. Like we need a lot more people, like a lot more. We need AI. We're going to need technology. And to be honest, we record every conversation. Like there will be a point in our future. Today, we're about 80% human. We'll go down to 40, 50% human over time, which then allows Grapefruit Health with only 1 million students to actually close that entire 3.2, right? Because now we're getting a multiple on those students.
Yeah, they become superhumans at that point.
Yes.
Superhumans use that.
Exactly. Because like what we can do with a large enough population is we can use AI for the low-hanging fruit, the more folks that want to engage with us in that way. And then for everyone else, which is the vast majority, it's human beings. The other thing I'd say is healthcare is extremely nuanced. It's not making a reservation at a restaurant, like filling the time, how many people. It's like two variables. Healthcare is like a wild amount to the point where there's like trust issues. Like if we're going to be servicing a client in the Appalachia region, they want to talk to people from the Appalachia region. They don't want to talk to somebody from Chicago, necessarily. Like there's a trust thing there. And we can do that. We match our patients to students based off language, culture, and proximity. So we have that cultural congruence. AI can't do that today. That's a big portion of it. The other thing I'd say is this. Healthcare organizations, their IT and tech teams are slammed. You talk to a large medical center, especially like a regional one, you're 18 months out if you're going to try to do an integration, a bi-directional integration, you might as well walk away. Your company will run out of money before you go live. So what's really cool about Grapefruit Health too is that we've taken a tech light approach. And I think it's really interesting. We're on a couple roadmaps for health systems as clients. We're in the number 1 or 2 slot. Why? Because we don't require integration. They're going, thank God, there's a solution that we're looking at that our project and business owners are not asking us to do this deep, massive integration for a pilot. We can come in, flat file, stand it up, 6 weeks it takes us to build and train the workforce. And like we're up and running, we can at least get the pilot sort of going there. And so all that is to say is technology has a place. Absolutely. I used to run as an operator, a technology company that was very successful. I get it. It's just for these kind of things and to get immediate results, like not waiting for 5 years when the AI is right or 10 years when it's right plus the integration, we can do it today. And that's what we're looking to do. Plus, we're also building your talent pipelines, which again, AI isn't an employer as far as I know. That'll be interesting actually if there's a company one day that's run by AI.
Like your AI is going to talk to my AI.
Yeah, exactly. And then we're working for the robots, I guess. But I don't know. So that's how we think about it.
Well, kind of moving in towards the tail end. I just have a couple more questions. But let's say you as a founder thinking through this, what are some of the risks? What are some of the risks of this getting derailed? What do you normally think through?
I think for us, there's a problem here it's not unique to us. It's unique to every single startup out there, and that's time. You raise money, and it's immediately being burnt down like a candle, right? And so if you don't get a new candle, like eventually the light's going to go out, right? And so right now we're on a timer. We just raised an oversubscribed pre-seed round, which we were very fortunate in this market to do that. And so now the clock's running fast. And so what we need to do is go live with as many clients as we can. The biggest challenge for all of us is the time it takes to close deals in healthcare. The average sales cycle is 12 to 18 months. And if you're bigger, if you're like a value-based care, implementer or something like that, it can be 3 to 4 to 5 years to get that going. And so you need 5 years of capital to pay all those people and run all those programs without a dollar of revenue coming in the door. And so for us, it's a timing thing. So we are hyper focused on being successful and landing and expanding on the clients we have, closing these immediate deals to do these things before, again, the light goes out and we have to raise our next round. That's not unique to anybody else.
Yeah.
What's unique to Grapefruit Health, I guess, as a risk is, well, that's a really hard question. I think maybe some sort of regulation that comes down that says nobody's allowed to talk to a patient unless they have a registered nursing license or something of that nature, which would obviously every call center in the country would shut down on there. That's like, those are like the big ones.
Okay. How else, this can be like the commercial part of it, but I mean, how else can people stay up to date with the work that you and the rest of the Grapefruit Health team are doing? give us a
Yeah.
shout out here. Floor is yours.
Thanks a lot. I appreciate that. So if you want to check out our website and learn a little bit more, go to grapefruit, one word, .health. Out there. We're one of the few .health domain companies. Nobody ever ran with that. We did it early. And you can go to our news page on there too. And you can just kind of see a lot of the tailwinds and things that we've done. But it also gives you a really good perspective on our timeline as a business and just how new we are to do that. You can also follow us on LinkedIn, Grapefruit Health, to do that. And we would appreciate any introductions to prospective clients. Those are on the provider side is health systems, but also medical groups, large primary care organizations, FQHCs, community health. And on the payer side, it's largely Medicare Advantage, accountable care organizations, and then Medicaid servicers.
Amazing. Amazing. So for those that have joined in, and if you found this content and this conversation helpful to you, it's certainly been helpful to me. Would you mind sharing it on social media? Would you mind commenting and even just, giving us some feedback on this? I'm very grateful when we can build a community. I think that's the key word here. It's a community. It's a community of doers, people that really want to make a difference within healthcare. And Eric, you're certainly in that category. So I'm looking forward to potentially having you come back on the show and just kind of giving us an update on where things are, and looking forward to our next conversation.
Thanks, Michael. I appreciate the opportunity.
You bet.